Dr. Anna Kirkland. She's a professor for the health management and policy at the University of Michigan. She joins us now on the show. Thank you again for taking time to be with us.
Thanks so much for having me.
I was on the U of M website before I came into the show today. You have such an amazing background. I'm like, okay, you're like 10 people in one.
I have a dream job. It's amazing. Yeah.
So before we jump into talk about the vaccine, I do want to talk a little bit more about your background, your education, and how that led you into some of the research you're doing as well.
Well, I should say first, my primary appointment is in women's and gender studies, and so I'm only in public health as a courtesy appointment because my research sort of grew in that direction. But I'm a socio-legal scholar, so I have a law degree and an interdisciplinary Ph.D. And I started out interested in discrimination and rights, and then I came to see healthcare and battles about health as really central to that, where people's health and identity is often maybe why they're discriminated against, or it's in that healthcare context that they're struggling over rights and duties and what they owe people and what our government should do. It really brings kind of everything together as we're all living through this together now, seeing how all this come together, right? The last year has been, a whirlwind on that. And so that's why that's how I got to vaccines. It's just such a really important political and social issue as well as a scientific one. And so that's the perspective that I come to it from. But these are social and political issues that are important to all of us, and we all have knowledge and expertise about them, and they're real in our communities and in our lived experience. And so that's how I think this through.
So before we jump into the vaccine, March was Women's History Month, but we also know that the pandemic is really hitting women more so than so many other people, and just from the standpoint from the workforce. And I wonder how much it's going to set back women in the workforce arena, because so many people are dropping out of work right now because it's just too much to handle to try to have to homeschool your kids and, try to do your work as well.
I know. I think we're going to see reverberations of this, for decades and decades, but I'm really worried about, I have an 8-year-old and a 13-year-old, and, and I've been living that too. I'm hiding out in my basement with this fake background, so I'm like, don't come downstairs, and we're all just doing the best we can. And yeah, I think it is really going to hit people, especially women. You're right. The numbers are really dramatic, and we're only going to understand it years from now.
Yeah,
but it's cataclysmic, I think.
And so many women are working, relying on these low-income jobs. When that bar, that restaurant shuts down, that is maybe their second income that puts the food on the table, that helps them pay that light bill on top of their other job. And it's just going to be sad to see how much this sets us back as women for the next 5-10 years.
Yeah, I think it's going to be huge in a bad way. Yeah.
I know. But that aside, let's talk a little bit more about your research and the vaccine. There is so much controversy and talk going forward right now about the vaccine. We've gotten through the pandemic. We now have a vaccine. The focus is going to go forward. Who is the vaccine available, but also trying to get a community that doesn't believe in vaccines to take this vaccine. Your thoughts on that?
I'm actually really optimistic looking around. Vaccine hesitancy is going down as more and more people are seeing people they know get it, and they're seeing that it can, that it's safe, and they're feeling more comfortable with it. A lot of times people, they feel nervous. They see this thing, it did happen incredibly quickly. Usually vaccines take multiple years. So just understanding how we got this and how it's been tested and how they can use it. People need to have some time to come around to that. And we've just gotten up, it's open to 16 and up in Michigan just very recently. So we're really on the cusp where we're going to actually have enough supply to really, have it available to everyone. So we're just beginning to confront, getting more people who might be hesitant. And, really, I think we're seeing good numbers on that. And I think the key is for people to have conversations with people they trust, that they have a personal relationship with, have that outreach, have the conversation, maybe multiple conversations. If you have someone in your life and you want to start this conversation, start it now. Maybe in 3 weeks after you have 3 conversations, they'll be ready. But this is not going away. This virus is not going to be the kind of thing that one dose crushes it. It's going to be with us indefinitely. We're going to have, continued outbreaks or the need for booster shots. So it's something to start talking about and getting people comfortable with. And we're seeing that happen. Faith leaders, community leaders are reaching out, and it's working.
We're talking with Dr. Anna Kirkland. She is a professor for health management and policy at the University of Michigan. And with that, though, what about some portions of the community, like for us here, Southwest Detroit, when you have people that maybe are undocumented and they're not comfortable going to get the shot because they feel like then they're going to be tracked, or there are going to be questions about their legal status or the status of their loved ones. How do we overcome that bridge?
That's a really hard one. I agree, because those people have a lot to be fearful about, and especially from authorities. And that is going to be a tough one. It will have to be, people from their community, people who speak their language, to find a safe place where that can happen, where they feel like, maybe some of our community health clinics where they've been before, those could be great resources. But, these are some of what's called the last mile problems, getting the vaccine to people that are very hard to reach. But, we're not there yet. We're still in the phase of getting, the last 40% or 50% of our population. I was just checking the numbers. Oakland County's at 33% of populations had 1 dose. Here in Washtenaw, we're at 45%. And even, Marquette's also at 45%, but Detroit's only at 20% vaccinated. And we need to get to about 80. We don't need to get everyone. So if there are folks who are really, really committed to not getting the vaccine because it's a longstanding belief of theirs, those are a pretty small number of folks, but we can get to herd immunity without them, right? So we need the large numbers of folks who are maybe a little hesitant. But those are the people with, for a trusted conversation with someone will really help. That people overwhelmingly report that they trust their doctors more than anyone else. And they trust the people in their families. You can say, look, please, I'm worried about you. This really would mean a lot to me if you would consider this, and then call them again the next week and ask them again.
Yeah,
it'll work.
And do you think that a lot of this is really going to hinge on trying to get as much of the vaccine to our primary care doctors, because we have a relationship with them, versus going to a mass vaccination site and not knowing the people giving you that shot in the arm?
Oh, that's a great point. Yeah, because most people do want to have a conversation with their healthcare provider, and this is happening on a scale where that may not be possible. That's a great point. Although I do think a conversation with someone they trust, it depends on the reasons why they're hesitating. But if someone says, "Look, I got the vaccine and it wasn't so bad," why don't I help you make your appointment? And we should keep in mind there could be lots of barriers. Sometimes just taking an action, I got to go look up the website. Well, I'm busy. It's like voting. There's a lot of little steps that you just have to take, but maybe a nudge for those kinds of things. Hey, let me look it up. Myers right in your area. Let me look on their website and see if I can find you an appointment. All those kinds of little nudges can also really help.
We're talking with Dr. Anna Kirkland. She's a professor of health management and policy for the University of Michigan. But when we talk about some of these communities, for so many of us, it's just common practice. We go online for everything. But I have friends who are elderly or seniors that live in the city of Detroit. They don't have internet. And everything is based on the internet. So is that a barrier in your research that you're seeing from trying to get some of the people that need to be vaccinated, getting them the information for them to trust the vaccine, for them to take those steps to get the vaccine? Just scheduling an appointment can be hard if you don't have the internet.
Right, especially, and there's a big difference for me if I'm trying to do something like that on my phone and that tiny little screen versus, I open my laptop because I much prefer to do it that way. But if, people are trying to do all this on their phones, or maybe they don't have good access. And Detroit is actually, we should remember it's a very large, physically large city. There's, you got to travel, and people may be having problems with that. So there are a lot of barriers that we're seeing people confront now. And the next few weeks are really going to be critical to see if we can overcome some of those. And, just to circle back to your point about women's work and women's labor, I do want to say that, worrying about other people and remembering appointments and scheduling appointments and reminding and driving people places, those are all women's emotional labor. We call that emotional labor, where you're keeping track of what other people need and trying to provide it to them. And that's real work. And, a lot of women are out there trying to schedule vaccine appointments, trying to do all this work, drive people. So, just one thing I would say is if you're a man and you want to help stop this epidemic, stop this pandemic, pick up some of that labor. Think about driving folks, trying to make appointments, scheduling, reminding, cajoling. This is all the work that people need to do in their own communities with people they know, and to reach out to people who trust them. And, if you have someone and they know you care about them, they need to hear from you about, that you want them to get vaccinated.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. Doctor, just another minute or two with you here on the MegaCast. We always appreciate your time and your expertise. We've had people prior to COVID-19 that, there's the so-called anti-vaxxers who were opposed to any vaccines. How is this different, and can you bring those groups together?
Well, I think there's some folks that are not convincible, but they're really a very small percentage of folks. And those are ones who really, devoted their time, their livelihood, their public identity, their political identity to it. And that, once you build up an identity around something like that, it's very hard to dislodge it. But most people are not committed to their positions in quite that way, and they'll move and they will, be cajoled by people they trust. And a core belief in the anti-vaccine community is that vaccines don't really work, and that past epidemics weren't really stopped by vaccines. They were stopped by other things like better nutrition and clean water. So I am really curious to see over time how that belief will hold up, because I think a lot of people are going to have a very ordinary experience of seeing this pandemic recede. And for the first time, we also have people cheerleading about having gotten a vaccine. Usually it's the benefit that nobody cares about because you didn't get sick. It's only about an experience that you didn't have. And now we have a lot of people having a really meaningful experience and that sense of relief. I know I almost cried when I got my first dose recently, and it was a really touching experience. And a lot of people are having that, and we've never had that on the pro-vaccine side. So I'll be really interested to see how that might change some of the dynamics going forward.
And with that, the dynamics, how much do you think it's really going to, for the people who don't want to get the vaccine, they're going to be excluded in so many things throughout the community because it's maybe going to be a requirement to show your vaccine card to do this or do that. And we should note that while it's getting a lot of attention about having to possibly have a vaccine to go on a cruise ship or to travel overseas, that's not unusual. When I went to Africa, we had to have so many vaccines.
Right.
Man, my arm was like hurting for weeks, and you had to go back for a series of shots and this, that, and the other. So that's pretty commonplace, but we didn't talk about it like we are talking about this COVID-19 vaccine. So do you think that some of the anti-vaxxers or some of the people that are on the edge about getting the vaccine are going to realize that this is just going to be commonplace for us?
I think that will provide just the nudge that a lot of people need, especially, it'll be some employers, some schools, I don't think we're going to see, Biden has said we're not going to have a federal mandate and, or things like that. So I think it'll be somewhat piecemeal if your job really depends on, being able to protect people from that. I expect colleges and universities may roll something out like that, although, we haven't heard that yet. Nobody's making these points yet because until we have a plentiful supply, it's kind of a painful point and not very helpful to talk that way. But I think we'll start to see that where employers and communities in some contexts will say, look, the only safe way we can do this is if we require the vaccine. And even then, there'll be medical exemptions for people who need them. And we can sustain herd immunity and have a safe society with people getting the medical exemptions that they need. So I don't think we need, there's always a safety valve exception, and that's okay.
Dr. Anna Kirkland with us. She's a professor of health management and policy for the University of Michigan. We so appreciate your time. Anything possibly I didn't touch on or ask you that you want to share before we say goodbye, though?
I would just really reiterate that, this is a significant issue for a lot of people, but for a lot of people, it's not a major thing in their lives. And, a couple of conversations with someone they trust will be enough to help them get vaccinated. And if someone can accomplish that, you're really doing a lot.
Well, we want to say thank you, and also best of luck to you on your research as well.
Thank you.